All right, another battle that we fought here in Minnesota was electronic health records. I think most Minnesotans don't know our medical records are sitting in Maine.
No, they don't. Yes, our medical records are sitting in our doctor's office, which is connected to probably the health data system of the health plan. And most people don't know that either. And it's all becoming very linked together, very connected.
And they promise they'll keep it safe.
And they promise they'll keep it safe. Yes, they promise to keep it safe, and they promise privacy. But as we know that when the government or other people have access to our medical records without our consent, they've already broken the privacy. The confidentiality is all gone. And in 2008, Governor Pawlenty, right out of his office, came a bipartisan agreement to require our insurance companies to send what's called patient encounter data to a data warehouse in the state of Maine. That data is then owned by the Minnesota Department of Health, and the Minnesota Department of Health has a contract with Minnesota Community Measurement, who is looking at this data to come up with scorecards on our physicians and our hospitals. And so these scorecards, doctors are rated according to their compliance with the way the government wants them to do medicine.
So wait, the doctors have to do medicine the way the government tells them to?
That's right. So there are 5 things that really show sort of how this works and the problem with this, and that is that the doctors have to keep the patient's blood pressure within a certain range, the cholesterol within a certain range, the blood sugar within a certain range. The patient should be non-smoking, and they should take 2 aspirin or 1 aspirin a day if they have a certain condition. And I like to point this out because doctors are then graded on this, which is totally dependent on the behavior of the patient or the genetics of the patient. Because what your cholesterol level is may be very difficult for you to control. And whether you exercise or how you eat may make a difference on your blood pressure and your blood sugar. How often, if you're a diabetic, you test yourself is all about the patient. The doctor cannot be in the patient's home telling them, check your blood sugar now. And whether the patient smokes or takes aspirin, I mean, this is kind of ridiculous. But the doctors are being graded on these statistics, which are coming through their health insurance company to the database in Maine, to this other analysis unit, and then coming out in November with the first scorecards or report cards on doctors. But the real thing for viewers to understand is this is not about quality of care. This is all about control. So by virtue of this fact of the government deciding the way medicine should look, how outcomes should be, and collecting all this data, which may or may not tell the whole story, is all about getting the doctor to comply and do medicine and take care of patients the way the government wants them to take care of them. They come out with it, calling it quality, but it's really all about compliance. And I think that we should all be worried when our doctors feel pressure from the outside about how to treat us in the exam room as though we are all alike in the way the government wants us to be looked at.
Troubling, most troubling. Another issue that we heard a lot about this year over at the Capitol was health disparities. Can you explain to the viewers what health disparities means?
Health disparities is a fine term that they have really, I guess the best way to say it is it's very broad. It makes you think that such a thing should not happen, but you have to understand how it's being used. So it's being used to gather data on patients according to their race, their ethnicity, their gender, their age, their location, their language, their sexual preference, a whole bunch of things that are being collected. And then essentially the doctors and the clinics and the hospitals are going to be judged or scored according to their ability to equalize health. So health equality versus health disparities. And we see this not only as intrusive and putting people in, racial and other kind of boxes and collecting all this data on them that become then part of this big health system and are sent to the state and all sorts of other places.
Data the government has no business collecting.
That's correct. We also see this as a way to push forward universal health care or national health care. And we see it as a way to bring civil rights violations into the exam room, not even looking at the fact that people are different. And so if you start to look at them, people from all these different boxes, as opposed to just, are they being taken care of? Then what we have is the potential for lawsuits on a doctor or a hospital for having poor health care for blacks, let's say, a typical civil right thing, versus whites, or poor discharge instructions for a person of this persuasion rather than a person of this persuasion. What we don't want is we don't want to give the government this kind of tool to use against doctors and to bring us towards health equality, which I think is another word for universal health care, which is not freedom. And anytime the government starts collecting this kind of data, starts doing this kind of analysis and putting people in these kind of boxes, there's no way that we can stay free. We have to undo the data systems. We have to undo the data collection. We have to undo all the analysis that is being used to push policies against freedom. We have to stop that. We have to give people their individual rights, their consent rights over who gets access to data, who can look at them, who can analyze them, who can capture and look at all this data on them.
I want you to repeat that comment about consent. That's how it's so important, because we talk about them collecting data for everything, your race, your sexual preference, take your pick. But they're also collecting data on if you're an Alzheimer's patient, if you use narcotics. They have a narcotics database. We have so many different databases in the state of Minnesota where they're collecting information from the people of Minnesota without our consent.
That's right. Yep, and it's all under really the guise of public health.
Right.
Right. So there's so much power in the health department under this idea that they can help and improve the public's health. Help. And, I guess I'd even go further. I do believe in informed written consent, and I believe it's an absolute requirement, and I believe that they wouldn't get lots of the data. But I'm also concerned about the fact that we even have these databases. I don't think in a free country we should be collecting any data on people. The only reason we collect data is to do something with it, and to do something with it is always the government doing something with it, whether they do it themselves or whether they give it to some contractor or some grantee or somebody to do this. And so, when you're talking about liberty does not consist in building databases on people. There might be a database for something that's completely, what am I trying to say, death producing. Fatal, there we go. For, like if there's a fatal illness like bubonic plague or, something like that. But not for all of these chronic illnesses, not for all the things about us, not for anything that really has to do with where the public health department should not be.
Tell us your website again.
It is www.cchfreedom.org.
cchfreedom.org, because it's all about freedom. And as we wrap things up, tell what can people do to help you, to get involved, to learn more? Where should we send them first?
The best thing is to go to our website, and they can either join one of our email lists. They can join
I get them.
They can join the Health Freedom Watch, which is a monthly publication which goes a little bit more in depth on certain really key issues that most of the news isn't talking about. And they can just be involved in some of our petition campaigns, like on the Exchange this year. So really, it's all about giving us their contact information so we can keep them informed and involved.
Excellent. Thank you so much,
Thank you,
Twyla Brase.
Sue.
I appreciate everything that you do for freedom in healthcare in the state of Minnesota. And I want everyone to know Twyla Brase is the smartest woman that I know, and I'm happy to help her on any project that she works on because it's awesome. Well, we've run out of time. This has been the Libertarian Viewpoint, the show that brings you the non-government solutions, liberty-based solutions that we rarely hear. Libertarians feel that liberty does work and that liberty is always the best choice. I also challenge anyone in government to prove to me that there is a government solution that has worked where a liberty-based solution did not. Thank you for watching, and stay tuned for other shows of Libertarian Viewpoint.